We tackled a few conditions that could be highly contagious today, but I want you to look at this photo. Do you all think this is contagious? Well, this is called subconjunctival hemorrhage. That's a mouthful, but essentially it's when a tiny blood vessel breaks underneath the clear surface of your eye, underneath the sclera. And what you're seeing here is typically the white part of the eye, there are little blood vessels underneath there. Occasionally, those can burst. When that happens, you'll get this severe bloodshot appearance. And there have been some people who've come into the emergency department terrified because it can look really scary. And it occurs for a reason.
It's very scary. And I mean, essentially, it's a bruise of the white part of your eye, the conjunctiva. But typically, one thing in common that you're doing something that's increasing the pressure in and around your orbit or the globe of your eye. What things can do that? Straining, coughing, sneezing, vomiting, lifting. Any one of those things, you may not even realize it, but you're putting pressure inside your globe, you can get that effect.
I just want to mention this. If you're getting these subconjunctival hemorrhages a lot, it could be due to really high blood pressure, and in some rare cases, especially if you have easy bruising, you could have a clotting disorder. So in that situation, it's worth getting it checked out. But let's move in, Dr. Lisa, too. When should we worry if our eye is red?
If it's infectious, if you have conjunctivitis. And that is just, you don't want to touch your eye and then touch somebody else because then you are going to spread it.
Difference, subconjunctival hemorrhage. Underneath the conjunctiva, that thin layer, there's bleeding. Conjunctivitis is actually inflammation of it's going to be all over. Probably both sides.
And usually not as solid a patch as that.
No, it's more all over, yeah.
Spotty, and typically, not always, it should have some sort of discharge or drainage with it, whereas this doesn't.